and request Dr. Banerjee. Dr. Banerjee, you have been the part of discussion and you have mastered as regard this particular topic is concerned. First of all, I would like you to tell us that this 2025 COVID, the clinically, what is the presentation and in what way it is different than others. We have been joined by Dr. Sunila Garg. Dr. Amitabh Banerjee is the person belonging to medicine and public health, and he is from T.Y. Patil Institute of Medical Sciences, Pune, a totally dedicated researcher. So, Dr. Banerjee, will you like to tell us about the clinical pattern of COVID of 2025?
Thank you, sir. Thank you, Dr. Agarwal. Thanks, everyone, for attending. And yeah, this is actually the surge started from Southeast Asia region. It started Singapore, Thailand, Malaysia, Hong Kong, and then India. So these subvariants, these are subvariants, or you can say sub-subvariants of Omicron, which came almost 3 years back. And I remember Dr. Sanjay Rai saying that Omicron will act as a nature's vaccine, because the Omicron onwards, it became milder and milder, but more transmissible. Number of cases were more and milder and milder. And subsequently, JN1 came last year also, a couple of years back. It did not make much of an impact in our country. Now we have got the sub variants, LF.7 and NB1.8.1 or Nimbus. So this is detected now. This has become more or less a dominant variant, 30% cases, not only in other parts of Southeast Asia, even in USA. But this is causing mostly upper respiratory, some sort of pain in the throat. We can say just as like a knife in the throat, but it is not causing a large number of hospitalization or deaths. It has been a co-infection with people who are with co-morbidities. So mostly there have been deaths also. There have been about 50, 60 deaths, maybe about little under 100 over the past month or so. But these deaths are in people who are having co-morbidities. So as on today, this is, I wouldn't say it is of much clinical consequence per se, standalone. Standalone, it is not causing much of an impact, but we have to take care. It gives a message that we have to have health services to follow, say, treat the comorbidities, treat the hypertension, treat the diabetes, treat the obesity, prevent the obesity. And that is the way to attack it now. Focus on the comorbidities rather than on the virus. So I think this is my take on it, sir.
So you want to say that from public point of view, it is a variation of Omicron, and as a part of public, I will like to know, should I worry about it?
I wouldn't worry if I am healthy, I am not having comorbidities. And even if I am having comorbidities, I would rather be worried about treating my basic comorbidity, my primary disease. So I am sure if I can control my primary disease, if I control my, and this has been the story right from the first wave. Particularly data from USA came, the maximum mortality were among the blacks, and they found that most of them were hypertensive without access to their treatment for hypertension, without access for treatment diabetes. So this has been the story from the very beginning. And of course, the earlier variants were slightly more virulent, and the story continues. And today, it is just an incidental finding in a person who is dying of some other cause, because these sub variants, the more lighter they are, the more benign they are more transmissible. They spread very far. So large proportions of the population will be harboring the this variant, and incidentally, they are tested. So they may not be related to the death at all. In fact, certification of death also got distorted. In the beginning, it was all right because we wanted to chase the virus. But in certification of death, anyone with a COVID positive or RT-PCR positive has been, cause of death is being labeled as COVID, which is incorrect as far the death certification is concerned. It may just be a other incidental finding. So now we should go back to our conventional death certification. We should go back to a conventional case definition instead of any asymptomatic incidental finding and labeling it a case. So we should now go back to what was since ages or since classification of a case or death certification.